everyone, and welcome back to The Smile Project, the podcast of the School of Dentistry at IMU University. Thank you for joining us today. My name is Shahed, and I'll be your host. So with us in the studio is the Dean of Liverpool University and the co-director for the undergraduate program, Professor Bissell and Mrs. Bowles. Would you guys like to introduce yourselves, please?
Hello, it's a pleasure to be able to talk to you about the University of Liverpool School of Dentistry.
Hello everybody, again it's nice to talk to you about our programs at Liverpool. I hope you enjoy listening.
Wonderful. Okay, so as you may all know, here at IMU in our Bachelor of Dental Surgery program, we have 6 partner school options, and our newest one is the University of Liverpool. So let's dive in, and hopefully we can answer any and all questions you all might have. So for the first question is, could you provide an overview of your dental program's curriculum and its unique features?
Sure, yeah, well it's a very unique program in terms of the UK, in that we have collaborative learning between our dental students and our dental therapy students for the first 3 years of the BDS program. And that effectively means that the curriculum for both groups is exactly the same. And then, obviously, after 3 years, the dental therapy students would graduate, and our BDS students continue on to do the scope of practice relevant to a dentist, which effectively means adding on endodontics, prosthodontics, and that is a relatively new curriculum. We've just graduated our first cohort of BDS students. It's been very well reviewed by the General Dental Council in the UK, which is the body which quality assures dental programs across the country. So we're very proud of it. We think it is quite unique, and the aim really is to make sure that dentists and dental therapists train together so that they understand each other's scope of practice and they're able to work together effectively in a practice situation. And so far that's proved to be quite successful, I think.
Well, that's good. That's something that IMU definitely doesn't have, is we don't have dental therapists here. But so when our IMU students join, they would join in the 3rd year.
They would join in the 3rd year, yes.
Right. Okay. So then what kind of dental technology or innovative technique does your school incorporate into its curriculum and its clinics?
Okay, so we've already touched on the innovative new curriculum that we've got, but from a technology perspective, we have a digital design suite that our students get involved with. They make use of 3D printed teeth, intraoral scanning that's undertaken. They do some CAD design for diagnostic wax-ups, for direct composite build-ups as part of their toothware management. Again, computer-aided design for cobalt chrome frameworks, and also they've been started to use intraoral scanning and CAD design for their crown preps as well. We also have now got 6 haptic machines, simulators that we use alongside our phantom head simulators to develop student skills as they're learning preclinical aspects of things as well. And I suppose probably another thing we do is with our medical emergencies training, we have our interactive mannequins that we connect onto the interactive screens, and the students get direct feedback instantly as to how well they're doing with their compressions, etc., etc. So there's a whole host of different things with regards to technology.
Absolutely, that sounds incredibly fun over at Liverpool. So what sets your program apart from other dental schools in terms of preparing dental students for residency and even dental practice?
Well, I think we have to be honest and say that all dental schools in the UK are probably in many respects very similar and provide a very similar standard of dental education. And they all really prepare students for practice because that's what they're required to do by the General Dental Council. I think there are maybe a couple of things I'd point to. One is that we do try to encourage students to be what we call self-regulating. We encourage them from a very early stage to adopt a reflective approach and also to acquire the skills of lifelong learning so that they can go out into practice and if they encounter a situation which is not immediately familiar to them, they at least understand how to go about addressing that problem and finding out more about it, and recognizing what their learning needs might be. Because I think we all recognize that we don't know everything at any one point in time, and learning goes on throughout your career. And the important thing is to recognize when there is something you need to learn and how to go about doing it. The other thing I would point to is that our students do have experience in actual dental practices, in our outreach placements. So those are family dentists who are part of our program. They're honorary staff with the university, and they take students into their practices, and the students treat patients within those practices, obviously under supervision. But that's allowing the students to get very direct experience of what it's like to be practicing dentistry in an actual high street dental practice. And that is very well regarded by the students, and I think it is a good feature of our program.
Yeah, absolutely. So then what is the student to faculty ratio, and how accessible are the professors and clinical instructors to the students?
Okay, so if we think about the clinics and the ratios there, generally they're 1 staff member to 6 students, I think, like it is here at IMU. So the students assist one another on the clinics, and we also have nursing support there as well, which goes down very well. Staff are very accessible, whether it be in a clinical environment or whether it be students trying to contact their academic advisors. They all have a named academic advisor who they meet 3 times a year, but actually they can get in touch at any point, at any time. We get quite a lot of feedback from students at different points throughout the programme, and they've recently reported that they're really satisfied with how easy they can access support, whether it be academic advisors or from the welfare team. We do encourage students to ask lots of questions and to speak to people if they need to. And definitely encourage the question asking.
Wonderful. Okay. So then, coming from IMU, from our side, what qualities or skills do you expect our incoming students to have when they begin in your program?
I think probably what I'd like to say in response to that question is that nobody coming to Liverpool from IMU should be particularly over anxious. Although we are a new school to the partnership program, I've been involved with IMU one way or another now for almost 10 years. So I'm familiar with the school, and I'm familiar with the students, and I'm familiar with the standards. And so I know that students coming to Liverpool from IMU will have been, generally speaking, very well prepared for what they're about to encounter. So I would suggest there's no reason to be particularly anxious about that. I think we do have quite a bit of self-directed learning, including problem-based learning. That does cause people to become slightly anxious, but there's really no reason to be anxious. It is all about really just having an inquiring mind and being prepared to go away and research problems on your own and come back and then join in the discussion. And that's another key thing about our expectations, really. It would be to get engaged, to don't hold back, to be part of the student group, to be part of small group discussions. Don't be afraid to do that, because by being engaged, you will get the maximum out of the program. But just to repeat that kind of message, I don't think that IMU students will have any reason to worry about facing issues of concern around learning styles, etc. Even where differences might exist, adaptation will occur fairly quickly and naturally, I think.
Right. Especially now with all the self-directed learning going on, and how students are becoming more independent with their own learning and their own studies. So.
Yeah, that's right. And so what we Mrs. Bowles mentioned the academic advising system. So what we encourage students to do as part of that is preparing for an academic advising meeting to really just have a look at their own feedback from various forms of assessment, including clinical assessment, and to identify what their learning needs might be, and then to set goals that they might expect to achieve over the next period of time. And then they can discuss that with their academic advisor, and their academic advisor can maybe just offer some suggestions around that, or maybe suggest that they're being too ambitious or not ambitious enough. But it is that kind of reflection going into the meeting, and then the dialogue that occurs to help students refine their learning goals for a period of time after.
Right. So then how important would you say soft skills like communication or teamwork, seeing as you guys have a lot of small group learnings over in Liverpool? So how would you foster that development?
I mean, communication is key within dentistry, and it's something that we cover a lot with the students. We have within first year, for those coming generally from school, we have a communication skills component where the students are learning the importance of communication skills and how to communicate in different ways. And it's actually something that we incorporate within the bridging course as well for IMU students that are coming to join us, to help them sort of feel settled, because sometimes there are questions that come about communicating, especially maybe if there's slightly different accents and things like that. So we do spend a bit of time doing that. But team working is essential. In the UK, dentists, dental therapists, dental hygienists, nurses, everybody's working together, and the communication between that team is important, really for patient care.
Wonderful. Okay, so then now, I guess question for both of you. What advice would you give to new students to help them succeed in your program or in dentistry in general?
Yeah, I think the important thing is to just choose a school they think they're going to be happy at, and make sure they feel the school is right for them. And I think engage, take opportunities. We've already talked about engaging as much as possible. Take opportunities, don't be afraid. Everyone's very friendly at Liverpool, so get to know people, get involved with the wider societies within the school, within the university. Just see where life takes you.
Yep, I think I would echo those sentiments. I think a lot is really about what you do to choose a school and prepare in advance. So, maybe a thing to do would be to sit down when you're thinking about this for the very first time and say, well, what am I looking for in that decision? What kind of criteria am I going to apply to this decision? Is there something particular about the studies that I'm interested in? Bearing in mind that will be very similar from one school to the next. Is there something about the geographical location, the culture, the kind of opportunities that might be available to me around my social life or for sport or whatever, to just kind of understand what the basis is for making your decision, and then to do some research about the various options to see how they match up to your criteria. As Mrs. Bowles says, the most important thing for us is to know that you are coming to Liverpool because you want to be in Liverpool. And I think if that's the case, then you are undoubtedly going to succeed, because you will be content and enthusiastic. And the last point is, again, as Mrs. Bowles has said, get involved. Don't be shy. Get involved. Get stuck in, because you'll find that it's an old adage: the more you put into something, the more you get out of it. But our students are very friendly. Our staff are very approachable. The people of Liverpool are extremely welcoming and friendly as well. And so you won't come across anybody who is anything less than enthusiastic if you want to become involved with things.
And if our students have any questions, could they contact either one of you, or is there somebody from IMU they can contact the international department?
I think they should probably contact Mrs. Bowles.
Yeah, that's fine.
Via email. We've been thinking about as we've been here for this academic council, we've been thinking about what we can do to support people who are thinking about coming to Liverpool. And I think what we might try to do is to put some additional information on our website, perhaps some FAQs and so on. But certainly we're always happy to get emails, informal inquiries, whatever, and we'll do our best to respond to those queries.
Oh, that's wonderful. Thank you both so much for joining us today. Hopefully this episode will help our students make their decision a more informed decision. So that's all for today's episode. Don't forget to follow us on social media at The Small Project IMU on Instagram and The Small Project on Spotify and YouTube so you do not miss our next episodes. Thank you.